Assalamu alaikum warahmatullahi wabarakatuh to everyone. Thanks for joining very much on time. Inshallah, we'll be starting our session in a while. In the meantime, I would like just to reconfirm if my voice is clear to all.
Yes, your voice is clear. Yes, sir. Hello, everyone. I hope all of you can hear me. I'm Dr. Harris from Galaxy Pharma, and we welcome you all to today's session on a very crucial topic, and the one which, as a company who have been working in gynecology and infertility field since last 18 years, we were in discussion with different gynecologists and key opinion leaders of Pakistan, and had this discussion like from every forum and to every doctor, and these were some questions that we thought should be answered. So we welcome you all once again to this exciting session, and we are hopeful.
I'm really very sorry. Thank you very much, Dr. Harris, for correcting me. My mic was off, so I will take start right from the beginning. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والأسر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. I would like to say thanks to all valued consultants, doctors, medical professionals who have joined us today here on this subject, which is, of course, safety concerns in times of crisis, minimizing risk of COVID-19. The topic today we have, why gynecologists were severely affected by pandemic. We further narrowed down our topic area, and that is disinfection. Is disinfection effective in OT, labor, ultrasound, OPD areas, and overall healthcare perspective as well? For this, what we have done, basically we have gathered multiple clinical trials conducted across the globe, effectiveness, persistence, analysis of different disinfectants being used in Pakistan most commonly and around the globe in general. We have tried to evaluate what WHO have said in past at different occasions in relation to disinfections in healthcare settings. We have also considered what in past CDC was of view in relation to disinfection in environment in healthcare settings, as well as in like controlling hospital acquired infections. So before proceeding further, I'm not sure how well this video will run, but as we know that the frontline force in this war against COVID-19 was our medical professionals across the globe, specifically in Pakistan, where Alhamdulillah, fatality rate, casualties are very, very low in terms of percentage, Alhamdulillah. And that's all because of the medical professionals who have fought very well in the front foot. So first, we would like to just give tribute to all those clinicians. I'm not sure how well this video will run. If voice is not so clear, I will request Dr. Harris to give me message. Thank you very much for for your patience and definitely for your contribution in giving this tribute to those who left, who got the cadre of Shaheed in this war. May Allah bless their souls in best of heavens. And may Allah bless all those who are still continuing their war against this pandemic. May Allah bless them. 25% of the healthcare morbidity due to COVID-19 are from gynae ops specialty. That's as well in Pakistan based upon the statistics gathered till July 2020. The additional casualties in August, which are still going on, these are not included in this factor of 25%. So that means in gynae ops, whether we are, whether this specialty is not directly treating COVID-19 patients at their healthcare settings, they need to be very, very cautious, and they need to review the protocols, they need to review the SOPs, and they need to review the training requirements of the staff at their healthcare settings to prevent any such kind of scenario, to prevent any transmission of virus within the healthcare setting. Major contact risk areas, if we like, as we all know that what WHO have talked about the parameters of definition of contact, providing direct care for COVID-19 patients without using proper and secure PPEs. Unluckily, in early phase, there was lack of availability of PPE. But Alhamdulillah, now in most of the areas, majority of the areas, healthcare professionals, they do have PPEs. But in my later slides, I will share even those PPEs are the risk factors. These are the risk factors if they are not managed well, if they are not carried well. Being in the same close environment as a COVID-19 patient, including sharing workplace, classroom, or household, or attending the same gathering. Traveling in close proximity within 1 to 2 meters to a COVID-19 patient in any kind of conveyance. Implications of COVID-19 on obstetrics gynecology practice. Issues in managing ultrasound. Of course, in gynecology, in obstetrics, mainly like in gynecology, ultrasounds cannot be avoided for long. Of course, triage approach can be done, prioritization can be done of patients which is urgently required and which can be delayed. Of course, best judgment prevail. But still, of course, ultrasound cannot be completely avoided in gynecology. Management of gestational hypertension. In case of preeclampsia, immediate interventions are required. So definitely we need to go into close proximity to the patients. Prioritization of patient, as I mentioned earlier, significant rise in preterm deliveries due to COVID-19. This is again an area in which definitely emergency management comes in, on our way. Preparedness of staff for handling patients. Emergency triage algorithm to identify high-risk patients means whether our staff is fully prepared, whether they are ready to manage such kind of situation, and to decide how they are going to prioritize patients so that overall workload can be divided, overall crowd can be divided, means unnecessary gatherings cannot be there in OPD areas. Alhamdulillah, most of the hospital settings are doing it very well. Most of the hospitals in Pakistan, which we have surveyed, they did it very well, means in most of the cases what they did, they disallowed attendance, multiple number of attendants, which was traditionally used to be very high in number, but now maximum 1 attendant is allowed in most of the healthcare setting, which is quite good. But definitely prioritizing patient, whether staff is prepared for prioritizing patients, preparedness of staff in terms of disinfection compliance. This is really very much important. Like we are, like in some cases, we mix up cleaning with disinfection. These both are very much different. So the cleaning staff, if we are thinking that cleaning staff is like taking it seriously, like they really, whether they are really aware what they are supposed to do, whether just one briefing session is fine with them, it's sufficient with them, or we need multiple training sessions, or like continued training sessions for them. In UK only, like 47% pregnant women affected by COVID-19 had preterm delivery, as reported by Mullins et al. In 2020 publication, recently published in May 2020. So like in 47% of those patients which were affected by COVID, pregnant women who were affected by COVID-19, they ended up with preterm delivery, as well as overall incidence of preterm birth have gone up because of the stress which pregnant women do have, because of the apprehensions, because of the concerns they do have, whether it will not be transmitted to my baby, whether my pregnancy will go smooth, what if I get infected. So all these questions and many, many more questions you all must be facing from your patients. And definitely that all adds up to stress, and we all know that stress is one of the contributory factor in preterm deliveries. Areas where social distancing and most of crucial SOPs are difficult to be followed by either patient or medical professional. Ultrasound scans, of course, you cannot maintain social distance. In labor rooms, you cannot maintain social distance. In OT, surgical interventions, you cannot maintain social distance. So when you cannot maintain social distance, whether simple PPEs will work and how well they will work. Respirators, for example, I will discuss later. It came up that respirators, that's a solution that will end the risk of acquiring infection from patient or transmitting infection to the patient, vice versa. But even respirators can have issue. I need to test my respirator before each time use. Every time I'm going to use respirator, I need to check it, I need to place it, I need to move my face up, down, right, left to see, and I need to see the filter, whether it's compromised or it's intact. So if I'm using PPE, like whether I have used loop for like putting it and removing it, or I have touched the outer surface, because outer surface is carrying microorganism. Outer surfaces are carrying bacteria. So not only the use of PPEs, but the disposal of PPEs, that's a major issue for which the staff, because you all are busy clinicians, very much busy in your practice, in managing the situation, sudden situations arising in healthcare facilities. So we practically don't know in most of the cases how all these, how seriously, how devotedly the cleaning staff is following those protocols in terms of disposal of PPEs and so on and so forth. So we'll discuss it later. If you talk about the ultrasound society, International Society for Ultrasound in Ops and Gynae, they issued very, very comprehensive, very interesting committee position statement in June 2020. The first one was issued in May 2020, and the last one is issued in June 2020. So they covered everything very comprehensively: preparation, cleaning, and disinfection, basically, in the whole management, the whole prevention from this pandemic spread. They divided into three classifications: the preparation, then the cleaning, and then the disinfection of procedure rooms, including surfaces, preparation, cleaning, and disinfection of equipments and instruments, protecting the patient and healthcare provider, environmental disinfection, ventilated versus non-ventilated areas. The intensity of disinfection will vary, will be different in ventilated and non-ventilated areas. In non-ventilated areas, ordinary disinfection will not work. We'll have to have more and more cycle. We'll have to be more and more cautious in non-ventilated areas as compared to ventilated areas, because the airborne transmission is longer in non-ventilated areas and shorter in ventilated areas, as like proven by multiple publications which have come up. By multiple, to be very frank, not dozens. There are total 4 trials which are published so far on this particular subject, like differences in between differences of transmission in ventilated versus non-ventilated. Ventilated doesn't mean the transmission is not possible. The duration of existence in air is reduced. It's 15 to 30 minutes, not more than that. Whereas in non-ventilated, it's even 3 hours up to 4 hours. So target areas for persistent disinfection: machines and instruments which like specifically in ultrasound area, in labor room, in OT, furnitures and furnishings, ultrasound area, OPD, clinic, labor, OT. For example, in furniture, if you are having linen, if you are having fabrics on furniture, try to replace that furniture which is having fabric. Uski jagah aap solid surface furniture लेके आ सकते हैं जिसकी आप mopping कर सकें, जिसकी आप cleaning कर सकें, जिसकी आप properly disinfection कर सकें. But if it's inevitable, means replacing fabric from the furniture is inevitable, then we'll discuss the solutions in later slides. Fabrics directly, indirectly in use of patients and healthcare staff. In most of the settings where we surveyed, they have already moved towards disposable fabrics, like disposable sheets, patient sheets, disposable gowns. So, but again, with those disposable, I will discuss what are the risk issues. कि कई जगहों पे जहां पे डिस्पोजेबल यूज हो रहा था, पीपीई भी यूज हो रहा था, everything was done, but still virus transmission took place. And why that happened, that we'll discuss later on. Surfaces and healthcare facilities, these are the target areas for persistent disinfection. Now, this is really very interesting. It is a WHO interim guidance which is issued on 15th May 2020, cleaning and disinfection of environmental surfaces in the context of COVID-19. So cleaning and disinfection of environmental surfaces. This is the guideline which they issued, and the frequency of cleaning and disinfection which WHO mentioned in this interim guideline, and the additional guidance which they provided. The 3 columns you can see on your slides, on your screen. Screening and triage area at least twice daily. Focus on high-touch surfaces, then floors, inpatient rooms, cohort occupied, at least twice daily, preferably 3 times daily, in particular for high-touch surfaces. Focus on high-touch surfaces, stating with shared common surfaces. Then move to each patient bed. Use new cloth for each bed if possible. Then floors at the end, when all the surfaces are done. Then the last thing is the floor. The last thing is the floor. Outpatient ambulatory care after each patient visit, in particular for high-touch surfaces, and at least once daily terminal clean. High-touch surfaces to be disinfected after each patient visit. Once daily low-touch surfaces. High-touch surfaces, floors, waste and linens removed, examination bed thoroughly cleaned and disinfected. After each patient, linens from the examination bed, if there is no linen, then it should be wiped, it should be cleaned, and then it should be disinfected before calling next patient. And there should be a gap. Disinfection doesn't mean that we can immediately get the other patient in. We need to give some a break, at least 15 to 20 minutes break is mandatory. Hallways, corridors, at least twice daily. High-touch surfaces, including railings and equipment in hallways, then floors at the end. Now, one thing is very important, in all cases, in these guidelines, as well as what we'll discuss later, floors comes at the end when all the surfaces, all the furnishings, all the fittings are done on upper surfaces. Then at the end, we need to do floors. Patient bathrooms, toilets, very high risk areas, very high risk areas for transmission. Private patient room toilet at least twice daily. Shared toilets at least 3 times daily. High touch surfaces including door handles, light switches, counters, faucets, then sink bowls, then toilets, and finally floor in that order. Avoid sharing toilets between staff and patients. Staff toilets, definitely, in most of the healthcare settings, staff toilets are separate. But just mentioned by WHO as a precaution. Now, एक बड़ी interesting चीज है. अब जो अगली slides हैं, वहां से आपको problem area नजर आएगा. Screening triage area को मैंने 2 मर्तबा clean कर दिया, 2 मर्तबा दिन में disinfect कर दिया. Is it sufficient? Is it going to protect like a clinician, is it going to protect healthcare staff? And is it really going to protect other coming patients and visitors? Twice, thrice, maximum 3 times की बात की गई है. क्या ये हमें protection देगा? Problem कहाँ पे आ रहा है? Where exactly problem exists? Problem कहाँ exist कर रहा है? वहां जाने के लिए हमें most commonly used disinfectants को पढ़ना पड़ेगा. We'll have to read them deeply in terms of persistence. इफेक्टिवनेस इशू नहीं है. जून का भी जो सेशन था उसमें भी हमने पेपर्स शेयर किए थे कि all these chemicals are highly effective, not just effective. They are highly effective against corona. They are highly effective against most of the pathogens. But there's a big question which I will share in later slide. Now, just for your review, all you all know this. 70 to 80% ethanol, we all know we are using. 1 to 2% hydrogen peroxide, we know we all are using. 0.1% sodium hypochlorite, all using. Benzalkonium chloride, all are using. Chlorhexidine, all using. Propanol, all using. Glutaldehyde, all using. Since information about SARS-CoV-2 is incomplete, I repeat, this is not my wording. This is a wording in WHO guideline. This is a wording in Al-Sipon et al. 2020. The most recent publication, the last week of June 2020. Since information about SARS-CoV-2 is incomplete, additional use of high-level disinfectants is recommended. High-level disinfectants are recommended. Additional use in even your clinical practice. For example, if you are in like a high-risk patient for miscarriage, you are not just using dydrogesterone. In some cases, you combine. You are not using just micronized progesterone. In some cases, you give dydrogesterone, you give micronized progesterone, you also give IVFC as well. आपने यूट्रोजेस्ट्रॉन भी दे दिया, IVFC भी दे दिया साथ आप और भी like interventions कर रहे हैं. Just the objective is that patient should not lose the baby. It's a high-risk patient, and we use all the available tools. So likewise, you can use hydrogen peroxide for during merging it with the cleaning phase, but how much longer protection it is going to give? For this, we'll have to go through this screen slide. You need to focus on this screen. Most commonly used disinfectants are effective, but how persistent and safe for exposure these are? Persistent कितने हैं? कितना long term effect है? Oral exposure के लिए safe कितने हैं? Inhalation exposure के लिए safe कितने? 70 to 80% ethanol if we are using, even if I'm using 90% ethanol, persistent effect, few minutes. It will kill pathogen immediately. Within 30 seconds, it will kill. For sure, it will kill. But within few minutes, there is no more effect. There is no more effect. The pathogens will start growing. They will start multiplying. Propanol, likewise, few minutes. 1 to 2% hydrogen peroxide. I will share later slide, even up to 4-5% hydrogen peroxide. Maximum persistence is 1 hour. It will remain effective for 1 hour and then it will degenerate. Sodium hypochlorite, maximum up to 1 hour. After that, no effect at all. The surfaces are exposed. Everything is exposed. 0.05 to 0.2% benzalkonium chloride. Persistent effect up to 4 hours. And then no effect. Everything is exposed. Plus, it's having very toxic effects. You cannot enter into the areas where you have used chlorhexidine, benzal. At least for 1 hour, you cannot. Even hydrogen peroxide, if you're using for a concentration of 3 to 5%, you need to wash the area. Once you have used, you need to rinse the area. अगर आप इन तमाम प्रोडक्ट्स के लेबल उठा के देखेंगे, आप हाइड्रोजन पेरोक्साइड के, एथनॉल जो फ्लोट्स के लिए आपके ब्लीचेस हैं, उन सब में ये है कि आपने कर दिया अप्लाई, उसके बाद पब्लिक को अलाउ करने से पहले आप उसको रिंस करें. Why do they say rinse? Because it is highly toxic, right? If it comes into contact, if it like is inhaled accidentally, if you touch your eyes, in some cases respiratory issues are there. 10 to 20 ppm silver iron, persistent up to 3 hours on skin and 7 days on surfaces. So this is the overall analysis of most commonly used disinfectants, their persistence and safety. Core question, affecting risk level. We need to see वो कौन सी चीज है जो हमारे रिस्क लेवल को डायरेक्टली अफेक्ट कर रही है, वो कौन सा फैक्टर है जो तमाम पीपीईज, तमाम प्रिकॉशंस के बाद भी हेल्थ केयर प्रोफेशनल्स को एक्सपोज कर रही है टुवर्ड्स ट्रांसमिशन. Whether immediate effect short acting disinfection solutions should be used in healthcare facility or longer persistent effect long acting disinfection solutions are beneficial. हमारा हल कहाँ पे है? क्या मुझे 1 घंटे चंद मिनट की डिसइंफेक्शन चाहिए या मुझे राउंड द क्लॉक? क्या मैंने 6 घंटे 4 घंटे बाद अपना हॉस्पिटल बंद कर देना है? क्या मैंने 6 घंटे बाद कोई लेबर रूम यूज नहीं करना, ओटी यूज नहीं करना? नो, दीज आर यूज्ड राउंड द क्लॉक. Hospital facilities are used round the clock. So we need solution, we need disinfection round the clock, right? So अगर हम 2-3 मर्तबा सिर्फ क्लीनिंग और डिसइंफेक्शन पे डिपेंड कर रहे हैं, जरूर करें, मगर फिर हमें जो गाइडलाइंस में दिया हुआ है कि यूज एडिशनल हाई लेवल लॉन्ग एक्टिंग डिसइंफेक्टेंट्स, डोंट जस्ट stay with short acting or immediate effect disinfectants. Go for long acting, go for high grade, go for advanced disinfection mechanisms. What advantage long acting persistent disinfection can have to healthcare facility and people within? इन सवालों का जवाब और इनको अडॉप्ट करना हमारे लिए बहुत जरूरी है. इन हेल्थकेयर सेटिंग इट इज इंपॉर्टेंट. कोविड, अगर हम कोरोना की बात करें, सो स्पेनिश फ्लू वाज आल्सो कोरोना वायरस. So 100 साल पहले आया था, रुका नहीं. 2001 में कोरोना वायरस अगेन आया, सार्स, रुका नहीं. 2005 में फिर आया, 2008 में फिर आया, फिर मर्स का नाम दे दिया, मिडिल ईस्ट का नाम दे दिया, फिर अफ्रीकन फ्लू का नाम दे दिया. These are all कोरोना वायरस फॉर्म्स. So it will continue. So हमें इसमें डरना नहीं है. We need to fight with it and we do have solutions. हमें सिर्फ प्रिपेयर्डनेस रखनी है, हमें अडॉप्ट करना है उन चीजों को कि ऑनवर्ड हम अब भी अल्हम्दुलिल्लाह कंट्रोल हुई है ना चीजें. सो वी जस्ट नीड टू मेक आवरसेल्व्स मोर सिक्योर. वी नीड टू मेक एवरीवन मोर सिक्योर. वी नीड टू स्पेसिफिकली मेक हेल्थ केयर सेटिंग्स मोर सिक्योर. ईद के बाद, बकरा ईद के बाद जो न्यूज आ रही है दोबारा सेकंड वेव की, स्टैटिस्टिक्स आर कमिंग इन न्यूज़पेपर दैट एवरी डे इट्स गोइंग अप. अल्हम्दुलिल्लाह उस तेजी से ऊपर नहीं जा रहा, बट इट्स गोइंग. कंट्रोवर्सीज हैं कि नहीं, टेस्टिंग इज लो, बट हमें irrespective of all these gossips, irrespective of all these actual और नॉन एक्चुअल इंफॉर्मेशन, हमें तो हेल्थ केयर सेटिंग्स को प्रोटेक्ट करना है to avoid any outbreak anytime. Most commonly adopted PPE alcohol है, as hydrogen peroxide based sanitizers and face masks. Alcohols are rapidly germicidal. Now this is published in clinical trials which are conducted very recently, where they stated, even the WHO, the first line, and this is from the WHO document, alcohols are rapidly germicidal when applied to the skin, but have no appreciable persistent residual activity. They say they will kill immediately, but they will not protect. They will not protect, they will kill immediately any like organism on my skin or on my surface, but it will not give persistent effect. Minute baad it's gone. Uske baad slowly viruses will start coming up again, pathogens will start coming up again, and within few minutes 0% effect, and then the whole surfaces will be exposed to risk. And in another clinical study found, they concluded that, and they said, found that gram-negative bacilli were transferred from a colonized patient's skin to a piece of catheter material via the hands of nurses in only 17% of experiments following antiseptic hand rub with an alcohol-based hand rise. Now, this is really very much interesting that they used alcohol-based hand, they did alcohol-based hand rinsing, and then they used instruments, like they shared instruments in OT areas, and 17% cases, the transmission was there. It's in current situation, it's a very high percentage. It's not a small percentage, right? So this supplements the earlier observation mentioned in first two lines, that alcohol-based sanitizers are very, very effective to kill virus and bacteria within seconds, but these are not persistent. In healthcare setting, where we don't have time to use like sanitizer and rinse our hands every second and every 5 minutes and every 10 minutes, surgery is in process, C-section is taking place. So every 5 minutes, I cannot rinse my hand. So like neither any nurse can rinse her hand every 3 minutes, every 5 minutes. So persistent effect is required on skin. Persistent effect is required on surfaces. Persistent effect is required in environment. Securely unsecure. Face mask, another second PPE on which we all are relying. These are face masks, face shields. Coronavirus can survive for more than a week on face mask. The new study, which was published in April 2019, यही उसके बाद ही फिर एक वेव चली कि नहीं जी आप 50 टाइम्स वॉश करें फेस मास्क को. गुल अहमद वालों ने भी लॉन्च किया, आर्टिस्टिक वालों ने भी, पाकिस्तान की दो का उनका हमारे जो वजीर साइंस एंड टेक्नोलॉजी है उन्होंने उसकी तारीफ भी की, और डेफिनेटली इट्स अ प्राइड फॉर पाकिस्तान कि मिलियंस ऑफ डॉलर्स के वो मास्क फ्रांस और यूरोप में एक्सपोर्ट हुए जिनको कहा गया ऑटो डिसइंफेक्टेंट मास्क. So I'm sure you all will be pleased that in all those masks, and now all the persistent mask, washable mask, which are coming internationally, launched internationally by multiple companies now, coming every week, they all are using silver. They all are just using nothing else but silver in their fabrics, which is converting their fabrics into auto disinfecting, washable disinfectant fabrics. But in most of the cases, जो N95 हम use कर रहे हैं, they are not having any persistent effect in it. They are not having it. They just have filters. And if you go on Environment Protection Agency's website, over there उन्होंने HEPA filter के बारे में कहा हुआ है कि it cannot completely eradicate. जब HEPA filter completely control नहीं कर सकता, completely eradicate नहीं कर सकता, so how the face mask filter, whether 3-layered or 5-layered, can save me absolutely. And specifically over a period of time, मैंने सुबह लगाया, रात तक लगाया हुआ है, और surface exposed है, and unconsciously हम उसको touch कर लेते हैं. आप सब अपने आप से सवाल कीजिए, unconsciously हम mask को touch कर लेते हैं. हमारे घर में बच्चे unconsciously mask को touch कर लेते हैं. Nursing staff unconsciously mask को touch कर लेता है. Healthcare professional, we all human beings unconsciously touch it, the outer surface. And the moment we touched, everything passed on hand, right? भले मैंने हाथ पे glove पहना हुआ है, transmission का process तो चल रहा है. From air to my mask, I touched accidentally, it came to my glove. I touched the surface, it went on the surface. So how I am going to handle this thing? How I am going to control this thing? How I am going to convert my existing resource? मैं पूरी resource बदलूं, या मैं कुछ ऐसा mechanism adopt करूं कि मैं उस resource को auto disinfectant material में convert कर दूं. When ongoing research still prevailing shocking facts about this pandemic, when country cannot afford complete lockdown, when virus transmission is from person to person, surface to person, air to person, indoors, when protective tools are themselves exposed to virus deposits on them, then highly cautious disinfection with long-term effectiveness can bring statistical relief. This is something which is missing in healthcare settings. This is something which is missing in our labor rooms, in our OTs, in hospitals where gynecologists are doing their practice, handling patients. Pregnant women cannot be avoided. Delivery cannot be delayed. So definitely, this is something which is important. Effectiveness of peroxide solution against microorganisms and biofilms. This is something just जो एक summary आपको पहले मिनटों की कि एक कौन सा 1 घंटा है, कौन सा 4 घंटे हैं, स्किन पे 3 घंटे कौन सी चीज है, 7 दिन कौन सी चीज इफेक्टिव है. So these are few studies which, for your interest, I'm sure you'll be interested to know that in contrast, a 1% test solution, like agar aap 1%, the results show that a 1% H2O2 solution was not sufficiently effective against all test organisms after a contact time of 1 hour. Even after 1 hour, it was not sufficiently effective. And 1% H2O2 solution is something जो आपको 3% का solution दे रहे हैं, उनके लेबल को देखें, वो भी कह रहे हैं सिर्फ डाइल्यूट कर लें 1% में. जो 1% का दे रहे हैं वो तो है ही 1%. जो 3% डाइल्यूशन के साथ हाइड्रोजन पेरोक्साइड आ रहा है उसको कह रहे हैं कि आप 1% पे ले जाएं या इवन 0.5% पे ले जाएं. इसलिए कि 3% अगर आंखों को लग गया या एक्सपोजर कंसंट्रेटेड हो गया तो इट मे कॉज ब्लाइंडनेस. सो डेफिनेटली you cannot go for more than 3%, but उसमें भी आपको heavily PPEs, face shields के साथ फिर एक staff जाएगा और वो पूरा clean करे, and then he will have to rinse afterwards. You cannot openly use 3% concentration. Yes, it was effective like with the 28%, but 5% के साथ risk of blindness है. So with 28%, the risk level will be significantly high. What our grandmothers used to use. This is like something I'm sure आप सबको याद आ रहा होगा. मुझे भी अच्छी तरह याद है. My mother used to, जब भी वो हलवा बनाती थी तो ऊपर वो चांदी की परत लगाती थी. So we all remember, we all can recall all these sweets. Lunch का time हो रहा है. Unluckily, pandemic की वजह से हमें webinar करना पड़ रहा है. अगर होटल में होता तो हम यकीनन उस वक्त भी मैं यही कहता कि थोड़ा वेट करें, सेशन कंप्लीट हो जाए फिर लंच होगा. बट इट्स अ लंच टाइम, खाने से पहले हम स्वीट्स की बात कर रहे हैं. बट वी ऑल कैन रिकॉल लाइक वी यूज्ड टू यूज चांदी की परत ऑन आवर फूड्स. व्हाई वी यूज्ड टू यूज दैट? जस्ट टू प्रोटेक्ट फूड फ्रॉम बैक्टीरियल ग्रोथ, फ्रॉम एनी फंगल ग्रोथ, टू मेक देम मोर. बिकॉज फ्रिज वगैरह उस जमाने में मुझे याद है, मेरी नानी लाइक व्हेन आई यूज्ड टू गो टू भावलपुर, it's very early days, even refrigerators were not so common at that time in all corners. So some of the stuff which she used to keep in cupboard, she used to have, you know, like chandi ki parat. Nahi beta ye 2-3 din agar idhar rahega bhi to it will remain safe, effective and fresh. Silver layering for protecting food from bactericidal, viral and fungal effect. And still, let me tell you, फूड प्रिजर्वेशन के लिए आज भी सिल्वर यूज होता है as an ingredient. Still used as silver nanoparticles in dental care, surgical instrument coatings, but we forgot its value in our daily life as a disinfectant. So आज भी कई mostly dental care instruments, surgical instruments हैं जो silver coated. Specifically, if you look at their label, it's mentioned that these are silver coated. Now I will come towards United States Environmental Protection Agency. In US, disinfectants are not regulated by FDA, but disinfectants are regulated by United States Environmental Protection Agency, EPA. If we look at the list of disinfectants for use against SARS-CoV-2, if you go to their website, you will see silver iron as an effective disinfectant against COVID-19. Inhibitory effect of silver nanomaterial on transmissible virus-induced host cell infection. Here you can see it is effective against coronavirus. Na sirf is study mein unhone they mentioned that it is non-toxic under non-toxic concentrations. We will talk about non-toxic concentrations. Any concentration below 30 ppm is non-toxic concentration. And what they said, it's not only effect like it's a good disinfectant, बल्कि उन्होंने उससे आगे की बात की है. उन्होंने कहा कि like there may be a therapeutic solution in using nano silver particles. In nanotechnology, there can be a therapeutic solution of these pandemics. Efficient and quick activation of coronavirus and other like pathogens exposed to the surfaces of some metal catalyst. This study is done in China, and in this, again, they said it's highly effective, and not only effective, it gave persistent effect, very long-term safety profile and long-term effects. Persistent silver disinfectant for the environmental control of pathogenic bacteria. Again, this is really very much interesting. क्योंकि हमें सिर्फ persistent, हमें long-term effect की बात करनी है, हमें long-term effect चाहिए. हमें सिर्फ ये नहीं देखना कि क्या ये disinfectant effective है. नहीं, सवाल ये है क्या ये disinfectant long-term effective है, और अगर long-term effective है तो सबसे ज्यादा long-term कौन सा है, right? So this is a comparative evaluation of 6 disinfectant formulations. Right here you can see not just one, there are 6 most commonly used disinfectant formulations were used. And here what they got, सिर्फ उन्होंने use नहीं किया, उन्होंने apply किया, like first clean, applied, then rinsed, और फिर उन्होंने expose किया pathogens को surfaces को, right? And then they read के application की कितनी देर बाद और कितनी washing के बाद भी ये disinfectants effective हैं. So what results they got? In addition, the silver, with your permission, I will just reread. The silver disinfectant was able to achieve significant residual activity in 10 minutes against all organisms tested after 1, 3, and 5 cycles of water rinse. Now, this is really very much interesting. Very much interesting. That if I follow the protocol of using silver disinfectant, if I use it properly, if I apply it appropriately on the surface, मैं उसे 3 मरतबा पानी से धो भी दूंगा उस surface को, effectiveness रहेगी. सिर्फ 10%, 5%, 8% नहीं रहेगी, even up to 90%, 80% effectiveness रहेगी, even after several days, right? Not several hours. This we'll prove later on in later slides. So in conclusion, you can see the same thing. The findings show the ability of a new silver-based disinfectant to reduce bacterial population that contact treated surfaces within minutes, highlight the potential to interrupt cross-contamination from environmental surfaces and reduce the risk of infection within home and healthcare settings, right? Antimicrobial activity of silver-treated bacteria against other multi-drug resistant pathogens in their environment. So this is done in Egypt. This study is done in Egypt, published in April 2020, using silver-treated disinfectants. So what? ये बड़ी मजेदार चीज है. हम, to be very frank, हम बड़े conservative जा रहे हैं कि like जो पाकिस्तान में first silver-based disinfectant है, उस पे अगर आप लेबल पे देखेंगे तो डिटर्ज के लेबल पे आपको बड़ी कंजर्वेटिव अप्रोच मिलेगी कि दे on that it is claimed that on surface effective for 3 days. SGS की report 7 days, 7 दिन तक SGS ने study किया, they found it 99% effective even up to 7th day. PCSIR, Ministry of Science and Technology, PCSIR laboratories ने up to 48 hours उसको persistent study किया because उनके पास technology इतनी थी. Like work technology का issue इतना ज़्यादा नहीं था, but workload, because you know PCSIR is having extraordinary workload nowadays. So I'm sure when they will be having time, they will be having longer persistent study on it as well. But this Egypt-based study, what they said, both silver-killed bacteria and supernatant showed prolonged antimicrobial activity against tested strains that extended to 40 days. Now, this is really very interesting. Okay, हम कंजर्वेटिव अप्रोच पे जा रहे हैं और हमें हकीकत में कंजर्वेटिव अप्रोच चाहिए, हमें ओवर एक्साइटेड नहीं होना, हमें लाइक आंख बंद नहीं कर लेनी है एक चीज को यूज करने के बाद. बट इफ वी लुक एट दिस publication, which is a peer reviewed publication, what they said that once the bacteria is killed, that will convert itself into a killing disinfectant reservoir. That bacteria will be killed and silver will overcome it, it will capture it, and that will become a reservoir, a supernatant to further multiply killing activity, and that will persist quite long. The presence of absorbed silver nanoparticles on the bacterial cell and inside the cells was verified by DEM. Silver-killed bacteria serve as an efficient, sustained release reservoir for exporting the lethal silver citations to the rest of the pathogens in later days and later hours. This promotes its use as a powerful disinfectant for polluted water and as an effective antibacterial which can be included in wound and burn dressings to overcome the problem of wound contamination. Silver use हो रहा है, burn dressings में use हो रहा है, पाकिस्तान में भी silver, कई आपके burn creams हैं, transdermal creams हैं जिनमें silver use हो रहा है, silver है. So it's not something very much new, but yes, हमें वो चीजें जो टाइम टेस्टेड हैं उसको दोबारा इस पेंडेमिक में वापस लेके आना है. Unluckily, the international forums, the bodies, उन्होंने अपनी previous guidelines में इसे बड़ा vocally जिक्र किया हुआ है, मगर जब नई आई तो उन्होंने सिर्फ अल्कोहल पे आके रुक गए, हाइड्रोजन पेरोक्साइड पे आके रुक गए. मगर बड़ी मजेदार, मैं आपको भी उन्हीं ऑर्गेनाइजेशंस की पब्लिकेशंस दिखाऊंगा, CDC की, WHO की. WHO कहता है अल्कोहल बेस्ड डिसइंफेक्टेंट आप यूज कर रहे हैं, which is उस अभी अगले डॉक्यूमेंट में आपको नजर आएगा कि which is immediate effect, not long acting. आपको देखना होगा, this is what we are saying, WHO, आपको देखना होगा कि क्या इसमें long persistent ingredient यूज हुए में, for example silver, copper. क्यों कह रहे हैं वो? जब पता है तो हम डे वन से अगर ये चीज कर देते तो शायद सूरत हाल बहुत बेहतर होती और बेहतर होती. आज बेहतर है और बेहतर होती. नो मैटर व्हाट हैपेंड हैपेंड, बट एटलीस्ट टू अवर एक्सटेंट हर मुल्क को, हर हेल्थ केयर फैसिलिटी को अपना SOP डेवलप करना है, हर गवर्नमेंट को, हर हेल्थ केयर फैसिलिटी को अपनी सेफ्टी प्रोटोकॉल्स को एनहांस करते चले जाना है. सिर्फ इस पेंडेमिक के लिए नहीं, हमें अगले पेंडेमिक्स के लिए भी अपने आप को तैयार करना है. Mechanism of silver nanoparticles as a disinfectant. मेरी आपसे like request होगी कि if you have any questions, so Q&A में you can keep adding. So we do have like a team sitting, they will just sort out the question and we'll see which questions, if we'll be having time at the end, we can address those questions live, or otherwise we will respond those questions later. So this is another study, a mechanism of silver nanoparticles as disinfectant. Here you can see the conclusion which they gave, and here they mentioned, sorry. Here, collectively, the advantages of using silver nanoparticles are: number one, long-term efficacy; number two, effectiveness at ultra low doses. Now, थोड़ा ये term आप अगली चंद स्लाइड से याद रखिएगा, ultra low doses. Effectiveness at ultra low doses. हम अभी बात कर रहे हैं 20 ppm, 10 ppm की, right? It is effective at even ultra low doses. And three, generation of little or no waste during its synthesis. Means आपको rinsing की जरूरत नहीं है. It's not going to generate waste like hydrogen peroxide. It's not going to generate waste like chlorhexidine, like alcohol, कि आपको बाद में rinse करना पड़े surfaces को. So collectively, number one, long-term efficacy; number two, effectiveness at ultra low doses, means it is effective even at 1 ppm. मगर 1 ppm पे effect आपको 1-2 घंटे बाद नजर आएगा, यानी जो पैथोजन को ये किल करेगा आफ्टर 1 hour, बट इफेक्टिव फिर ये रहेगा कंटिन्यूसली 8 to 12 hours तक, राइट? अब आप 10 ppm का डाइल्यूशन यूज करते हैं 5 ppm का dilution use करते हैं, it will remain effective up to 3 days, 7 days. 3 days हम claim कर रहे हैं conservative, but जो SGS and internationally जो SGS ने testing conduct की हुई है, it says that it will remain effective up to 7 days as per report. क्योंकि उन्होंने study ही 7 दिन तक किया, 7वें दिन भी 99.99%. So here you can see in this study that bacteriostatic activity up to 12 hours and bactericidal activity up to 8 hours at 1 ppm. At 1 ppm, ये आप जरूर जहन में रखिएगा कि 1 ppm पे 12 hours bactericidal activity up to 8 hours and 8 hours up to for 8 hours for bactericidal and 12 hours for bacteriostatic at 1 ppm concentration, whereas hypochlorite, you can see here, I hope you can read, whereas hypochlorite persistent was limited to approximately 1 hour. Now this is really very much interesting. This is what I said earlier. हमने कोई बात, like like we don't talk, we don't make any unauthentic claim. हम कोई बात ऐसी कभी भी नहीं करते कि जो clinically supported, clinically backed ना हो. So hypochlorite, so it's hardly 1 hour. तो 1 घंटे बाद क्या, अगर मैंने दिन में सिर्फ 3 मरतबा क्लीनिंग और डिसइंफेक्शन करनी है, 1 घंटे बाद वो खत्म, अगले 3 घंटे 4 घंटे क्या हो रहा होगा? ट्रांसमिशन। फिर मेरी किस्मत है, फिर मेरा नसीब है, मेरे हेल्थ केयर वर्कर का नसीब है, किस्मत है, राइट? मतलब हमने, अल्लाह ताला ने हमें ये नहीं कहा कि गाड़ी के आगे जाके खड़े हो जाओ और मैं तुम्हें बचा लूंगा। बचाने वाले अल्लाह ताला की जात है, मगर कोशिश का अल्लाह ताला ने हमें कहा है, शऊर अल्लाह ताला ने हमें दिया है। सो राइट और रॉन्ग का डिसीजन हमने ही करना है। उसके हिसाब से जो मंजिल तय है वहां हम पहुंच जाएंगे। अगर सही हमने रास्ता चुना है तो सही वाली मंजिल पे पहुंच जाएंगे, उसे हम नसीब कह देंगे। नसीब दोनों ही होंगे, अगर गलत चुनेंगे तो गलत वाले पे पहुंच जाएंगे, वो भी नसीब ही रहेगा, राइट? सो दोनों चीजें हैं, बट इट ऑल डिपेंड्स व्हिच पाथ आई अडॉप्ट। Effect of silver nanoparticles on common bacteria in hospital surfaces. Comparison between alcohol, chlorine, and silver nanoparticle was done in this study. Silver nanoparticles had appropriate effects in all 3 types of dilutions, allowing for a more protracted contact time has given significantly better results. Means much longer effects. इस study में भी उन्होंने persistence की बात की, as compared to chlorine or alcohol. In healthcare settings, in hospital surfaces, silver nanoparticle gave very long protection. Very long protection. Now this is interesting. Now WHO guideline in 2009, WHO guideline on hand hygiene in healthcare, first global patient safety challenge, clean care is safer care. In 2009, what they are saying, hand hygiene research agenda. क्या research agenda होना चाहिए in both developed and developing countries? Agents, indications, choice of hand hygiene product, technique. Identify the most suitable agent for hand hygiene based on a set of valid criteria. Determine the role of alcohol-based hand rub. Gloving पे use करना है, hand rubbing versus gloving or hand washing to prevent the transmission of spore-forming pathogens. उसके बाद ये क्या कह रहे हैं? Determine if preparations with sustained antimicrobial activity. Now, sustained antimicrobial activity, यहाँ पे नहीं ये लफ्ज यूज किया इन्होंने. What they are saying, determine if preparations with sustained antimicrobial activity, for example, based on various components, example, triclosan, chlorhexidine, silver, it's not safe. Just 4 hours effectiveness, not safe. Just 1 to 2 hours, not safe. Sorry, it's again 4 hours, but not safe. Try triclosan, chlorhexidine, 4 hours effective, and not safe. You need to rinse afterwards. Silver, you need not to rinse, or आप lower doses में use कर रहे हैं तो it's completely non toxic, even there is no inhalation risk. Now again I repeat, determine if preparations with sustained antimicrobial activity, triclosan, chlorhexidine, silver, are more effective to reduce infection rates than those whose activity is limited to an immediate effect when used for hygienic hand antiseptics. No, this is so clear. This is so clear. कहा जा रहा है कि immediate effect जो है वो आपको sustained release effect नहीं देगा. Sustained release effect आपको sustained release से ही मिलेगा. So let it be alcohol, let it be hydrogen peroxide, let it be hypochlorite, chlorine. These are immediate effect, not sustained release, not sustained antimicrobial activity. In a healthcare setting, we need sustained antimicrobial activity. हमारा मसला immediate effect से हल नहीं होता, बल्कि मैं तो कहूँगा even घरों पे भी, even for my kids, अगर मुझे choice दी जाए, क्या मैं सिर्फ immediate को prefer करूँगा या मैं चाहूँगा कि sustained protection रहे? I would like to have sustained protection. Guidelines for disinfection and sterilization in healthcare facilities 2008 updated in May 2019. Now CDC May 2019 तक क्या कह रहे हैं सिल्वर के बारे में? Metals such as silver, iron and copper could be used for environmental control. This is so interesting. Why they have not used it? Why they have not used it from day one? From day one to control this pandemic? At least in healthcare facilities, so ये use हो जाना चाहिए था. Metals such as silver, iron and copper could be used for environmental control, disinfection of water, or reusable medical devices, or incorporated into medical devices. A comparative evaluation of 6 disinfectant formulations for residual antimicrobial activity demonstrated that only silver disinfectant, means पहले वो बात कर रहे हैं silver, iron and copper की, फिर वो बात कर रहे हैं a comparative evaluation of 6 disinfectant formulations for residual antimicrobial activity demonstrated that only the silver disinfectant demonstrated significant residual activity. So this is something which is like, I'm sure, like motivational in this current scenario. Okay, हम एक extraordinary protected environment अपने healthcare workers के लिए, hospital healthcare facilities के लिए develop कर सकते हैं using silver nanoparticles. Conventional type में this is what's happening. After minutes and just 1 hour, everything is exposed, even after cleaning and disinfection of after 1 hour. Or we can have secured environment everywhere, right? We can spray silver nanoparticle on our outer mask, outer layers of mask. We can spray on handle. We can spray on floor. We can use it on floors. We can use in hospital beds, on gowns, on stethoscopes, on linens, on fabrics, and we can prevent transmission, and we can convert all these surfaces into auto disinfecting surfaces. Daily applications, these are just few examples of daily applications. So these are just a few additional applications proven by multiple studies. Italy में ये study published हुई है in very recently in June 2020. This is a publication wherein this said that use of this silver nanoparticle in coatings and spraying in composite sputtered coating directly applied on mask, convert the mask into auto disinfecting mask. So here you can see reduction in bacterial contamination of hospital textiles by a novel silver based laundry treatment. Now this is really very much interesting. आप linens wash तो कर रहे हैं, हर hospital में linen wash हो रहा है. Now treating hospital patient textiles with ionic silver after each washing, जब आपने wash कर लिया, आपने नॉर्मल ब्लीच के साथ इसको मिक्स नहीं करना। अगर ब्लीच के साथ इसको मिक्स करेंगे इसका इफेक्ट न्यूट्रलाइज हो जाएगा। जब आपने कपड़े वॉश कर लिए, चाहे घर में चाहे हॉस्पिटल में, जब आपने कपड़े वॉश कर लिए हैं तो एक बाल्टी अगर आप भर रहे हैं उसमें आपने 30 लीटर भी डाल दिया है पानी या 40 लीटर पानी भी डाल दिया है, तो आप उसमें 20 to 30 ml अगर 20 ppm कंसंट्रेशन का कोलोइडल सिल्वर डाल देंगे, डालने के 30 मिनट के बाद उस बाल्टी में आप कपड़े रिंस करते रहें और सूखने के लिए लटकाते रहें। The moment those dresses will dry, they will be auto disinfectant dress for at least next 3-4 days, right? So that will give a simple protection. So this is what they did. The washing ke baad they did a second procedure of rinsing, but in that second procedure of rinsing they used silver nanoparticles. And this product which they use, silver colloidal solution, the silver ion, that is a registered product for use in general textile and hospital textile washing. So it's not from air, it's not something a theory only. Now it is very much a commercial product available in US as a hospital textile washing laundry treatment. Wide spectrum activity of a silver impregnated fabric. This is again जो हम बात कर रहे हैं infection control के लिए, कि अगर आप surfaces को impregnate कर दें with the silver, so it will give a wide spectrum protection. Even जो drug resistant microorganism है, multiple trials are conducted जिसमें है कि it's effective against all drug resistant microorganisms. The silver lining of disposable sporicidal privacy curtains in an intensive care unit. So in this trial what they did, या तो इन्होंने वो कर्टन्स लिए उस फैब्रिक के जिस फैब्रिक में मैन्युफैक्चरिंग के वक्त सिल्वर नैनो पार्टिकल्स इम्प्रेग्नेट कर दिया गया, या फिर उन्होंने वो कर्टन्स प्लेस किए कि जो कर्टन्स थे जिनको इन्होंने बाद में या तो वॉश करके सिल्वर के साथ वॉश करके रिंस करके यूज किए, जो पार्टीशन कर्टन, पेशेंट आ रहा है और आपने पार्टीशन कर्टन लगाए हुए हैं। कुछ डॉक्टर्स को हमने देखा था उन्होंने ओपीडी में आगे फिर उन्होंने पीवीसी शीट्स लगाई हुई थी पेंडेमिक से ट्रांसमिशन से बचने के लिए, तो उस पीवीसी पे भी तो आके बैठ रहा है वायरस, तो आपको उस पे स्प्रे करना है। यू जस्ट नीड टू लाइक वॉश दैट पीवीसी, यू नीड टू रिंस दैट पीवीसी, यू नीड टू spray the linen, the fabric with the silver nanoparticles and let it air dry, and that will remain effective for like several hours and of course few days. But अगर आप डेफिनेटली कोई फैब्रिक है जिसमें मैन्युफैक्चरिंग के वक्त यूज हो गया, तो उसमें फिर आप जिस तरह गुल अहमद वाले भी क्लेम कर रहे हैं कि आप 50 मरतबा भी वॉश कर लें तो इट विल रिमेन एंटीवायरल। सो बट अभी तक कोई क्लिनिकल ट्रायल 50 वॉशिंग वाला नहीं है, तो मैं एटलीस्ट, हाँ हमारे पास 5 टाइम्स रिंजिंग का है कि आप जिस तरह ये डाइल्यूशन है इसे आप सरफेस पे कर रहे हैं, आप 5 मरतबा उसे धो भी देंगे तो इट विल रिमेन इफेक्टिव। सो आप WHO प्रोटोकॉल अगर फॉलो जो भी आप कर रहे हैं कि 3 मरतबा आप रिंस कर रहे हैं, 3 मरतबा डिसइंफेक्ट कर रहे हैं, तो आप 3 मरतबा ही रिंस करिए फ्लोर को, मगर 24 घंटे में 1 मरतबा बस ये अप्लाई कर दें, सिल्वर नैनो पार्टिकल अप्लाई कर दें सरफेसेस पे, उसके बाद आप रिंस करते रहें सिंपली। सो आपको फिर केमिकल बाद में बार बार ऐड करने की, या आपको ब्लीच बार बार या आपको हाइपोक्लोराइड बार बार ऐड करने की जरूरत नहीं है। Silver ion antimicrobial technology decontamination in nursing home. This is in nursing home में उन्होंने यूज किया था, और ये this is something which you can see, जो मैं आपसे बात कर रहा था कि डोर्स पे, डोर हैंडल्स पे, आर्किट्रेव पे, लाइट स्विचेस पे, इलेक्ट्रिकल सॉकेट्स पे, रेडिएटर गार्ड, बेड, वार्डरोब, बेडसाइड टेबल, बिन, कर्टन, सेफ्टी रेल, हैंड वॉश बेसिन्स, टैप, मोल्डेड शीट टाइल्स, soap dispensers, toilet seats, and you can see, and this is the effectiveness for several weeks which remain there. So of course we are not saying कि आप 7 दिन तक इंतजार करें कि नहीं जी हम रोजाना बैठ के ये स्टडीज नहीं कंडक्ट हम तो अपने पास नहीं कंडक्ट कर सकते। So like आप अगर हम ज्यादा ना रोजाना तो कर सकते हैं, अभी तो हम ये नहीं कर रहे, अभी तो अगर हम अल्कोहल भी कर रहे हैं, हाइपोक्लोराइड भी कर रहे हैं, कई चीजें तो कोरोसिव हैं, यानी अल्कोहल इज कोरोसिव, हाइपोक्लोराइड कोरोसिव, हाइड्रोजन पेरोक्साइड कोरोसिव. We cannot use them on metals, right? So we cannot use them on wood. But here, silver nanoparticle you can use very easily. It's non-corrosive, it's odorless, right? So these are all just studies. वही बात दोबारा repeat हो रही है. These are the protections which give. These are few studies which I will just like to share before going for an end. In vivo human time exposure study of orally dosed, जो अमूमन हमारे जहन में आता है कि हाइड्रोजन पेरोक्साइड टॉक्सिक है, नहीं हम यूज नहीं कर सकते, पेशेंट के बैठे हुए यूज नहीं कर सकते, अपने होते हुए यूज नहीं कर सकते, पता नहीं क्या होगा, लाइक टॉक्सिसिटी ना जनरेट हो जाए, इरिटेशन ना डेवलप हो जाए, रेस्पिरेटरी प्रॉब्लम ना क्रिएट हो जाए. So in vivo human time exposure study of orally dosed commercial silver nanoparticles. So in US, this study was done in which in 60 patients, they gave 60 patients को जिनका age group जो है right from 16 years till 80 years था, उनको दो ग्रुप में डिवाइड किया और 30 पेशेंट्स को इन्होंने 10 ppm का सॉल्यूशन orally दिया, right? Because it's food grade. और बाकी 30 patients को it's 32 ppm दिया, nanoscale silver particle solution, right? And what they concluded, no clinical important changes in metabolic, hematologic or urinalysis measures were identified. No morphological changes were detected in the lungs, heart, or abdominal organs. No significant changes were noted in pulmonary reactive oxygen species or pro-inflammatory cytokine generation. So means it's fully safe. It's fully safe. अगर मेरे OPD एरिया में पेशेंट बैठा भी है और मैं अपने स्टाफ से कहता हूँ कि जाके आप सिंपली जस्ट स्प्रे, आप पूरा एक स्प्रेयर पकड़ो और स्प्रे करके आ जाओ. Because once sprayed in air, the particles, the nanoparticles remain in air for 3 hours, right? So, अगर non-ventilated OPD area भी है और वहाँ पे किसी पेशेंट ने accidentally mask हटा दिया है और air में pathogen virus आ भी गया है, so the particles will be waiting for those airborne viruses and pathogens to grab them and kill them immediately. So you can say by spraying it in environment, you will be converting those environments into virus-free zones. So we don't recommend, to be very frank, this is just for information. This study is published in India. India में they did a clinical trial in which जैसे ही patient को coronavirus report हुआ या symptoms, initial symptom नजर आए, तो within 24 hours they basically उन्होंने जो है nebulize किया patient को with food grade nano silver particle 3 times a day. And this immediately killed the virus, and the patient was recovered within 3 days and discharged and went back home. So ये just उस सवाल का जवाब हो सकता है हमारे यहाँ, because in Pakistan we do respect our regulatory body, and definitely unless registered clinical trials are allowed and done, definitely things cannot be used for therapeutic. But this was done. ये हमें इतना कॉन्फिडेंस जरूर देता है कि अगर हम लाइक अपनी नॉर्मल रूटीन के दौरान भी इसको अगर हम एनवायरनमेंट में OPD एरियाज में जहाँ पे पेशेंट बैठा हुआ है या मेरे कमरे में है और मैं छोटा सा एक एटोमाइजर अपनी टेबल पे रख लेता हूँ और उसमें ये फ्यूम्स इसके निकलते रहते हैं और फोग निकलती रहती है, तो सिर्फ साइकोलॉजिकल सेटिस्फेक्शन नहीं होगी मुझे, I will be fully protected, my visitor, my patient will be fully protected, my staff will be, my room will be fully, I'll be safe and sound. The silver lining towards the responsible, I'll just वही चीजें हैं, effective and safe disinfection solution. हाँ, it does not mean like जो आपको nebulization की आपको studies mention की, जैसे मैंने पहला कहा कि sharing doesn't mean that कि आप इसको therapeutically use करें. Silver nanoparticles are not approved anywhere in the world for use in therapeutics so far, right? These are used for disinfectant, and these are approved for use for disinfectant for surfaces, as a disinfectant solution for surfaces, as a disinfectant solution for coatings in medical devices, so on and so forth. So this is just a comparison chart of nano silver with other disinfectants which we use. Here you can see it's having no shortcoming, whereas in all other you can see shortcomings, and you all know these shortcomings, that alcohol is flammable, prolonged contact may irritate skin or cause allergies, strong अगर हम hypochlorite की बात करें, it's a strong carcinogen, strong corrosion, irritating respiratory mucosa, increases the chance of a cold of a cold for babies. Same is the case with hydrogen peroxide, irritation for skin, irritation, severe blindness. It causes severe blindness if goes up to 5%. Tissue necrosis, pulmonary edema. Same is the case with sodium hypochlorite. So many side effects with that. यही वजह है कि इन सारे जो आप भी अगर आपके पास यूज हो रहे हैं, आई एम श्योर लाइक पब्लिक ट्रांसपोर्ट उस वक्त वहाँ पे नहीं होती होगी जब आपका स्टाफ इसको यूज करते हैं, और हर जगह पे हमने देखा है जहाँ पे ब्लीच यूज हो रहा होता है तो उसके बाद रिंस भी हो रहा होता है, और स्टाफ को नहीं जाने दिया, कोई पर्सनल वहाँ पे नहीं होते, नॉर्मल मूवमेंट वहाँ पे नहीं होती until that disinfection protocol is taking place. So safety, you can see in nano silver, safety is very high. Sterilization efficiency is very high. Effect continuity is long. In all other, it's short. Or ये तो WHO ने भी कहा, like these are all immediate acting. Cotton fabrics misting की ये misting clinical trial है, which is done कि आप अगर मिस्टिंग कर रहे हैं तो सिंपली मिस्टिंग भी आपके फैब्रिक को जो है वो ऑटो डिसइंफेक्टिंग में कन्वर्ट कर देगी. अगेन दिस इज समथिंग, ये फॉगिंग है कि अगर आप फॉगिंग मशीन रख लेते हैं या आप ह्यूमिडिफायर के जरिए इसको डिस्पर्स करते हैं, इसके पार्टिकल्स को अपने वेटिंग एरियाज में, अपने ऑफिस में, जैसा कि मैंने पहले मेंशन किया. So these are the guidelines, comments on fogging applications by Association for Professionals in Infection Control and Epidemiology, the Society for Healthcare Epidemiology of America, Association of Healthcare Environment. अगर हम इनकी बात करें तो what they concluded, one demonstrated use for this technology is to assist with control of an outbreak caused by microorganism, which is continuing unabated, wherein the environment of care is implicated. For rooms previously occupied by patients, on contact precautions, for multi-drug resistant organisms, to demonstrate whole area of patient care equipment that epidemiologic investigation implicates, possible involvement in clusters of healthcare associated infections. Other potential areas include sensitive equipments that may be difficult to disinfect after cleaning. Quarantine rooms, so this is something जहाँ पे आप एटोमाइजर्स प्लेस कर सकते हैं या फॉगिंग मशीन्स प्लेस कर सकते हैं, जिसमें आप डाइल्यूशन सिल्वर नैनो पार्टिकल्स का रिड्यूस डाइल्यूशन 5 ppm पे 2.5 ppm पे करके you can disinfect environment for longer durations. This is just a video. I'm not sure how effectively it will be run. So this is something which I would like to share with you all. Is there any colloidal nanosilver ion particle disinfectant solution available in Pakistan? The answer is yes. By the name Deterge. Deterge is the brand name, of course. Nanocolloidal silver disinfectant solution, most effective and safe disinfectant for healthcare facilities, homes, hotels, any public place, all indoor environments. 20 ppm concentration for safe for oral dermal exposure. It's halal, completely alcohol free. This is a test report which is done on human coronavirus, which showed its complete like 99.99% effectiveness against corona. This is the test report done by PCSIR. And the dilution for this product was 10 ppm. This is 5 ppm. As I said, at lower concentrations, maybe it is very highly effective. Here you can see it's 99.99%, even at 5 ppm, right? 10 ppm, you can see 99.99%. The most interestingly, you can see it's 2.5 ppm. Na 10, na 5, 2.5 ppm. Even at 2.5 ppm, it's 99.99% effective. This is the SGS report. SGS is one of the most authentic and trusted testing laboratory worldwide. And they studied silver nanoparticles solution 10 ppm. And the effectiveness was 1 day, 99.99%, 3 days, 99.99%, 7 days, 99.99%. So it comes in 5 liters, in 1 liter. These are concentrated solutions, means these are 20 ppm solutions. Ready to use 500 ml at 10 ppm and 100 ml at 10 ppm. These are ready to use. SGS says 7 days, but on Deterge, we say just like effectiveness, remain effective for 3 days. Of course, it remains effective for 7 days, but we are going conservative. We are very, very conservative in making claim. Deterge cleaning and disinfection protocol for surfaces. Step 1, clean surfaces completely using existing cleaning protocols. Step 2, let surface get dry post cleaning. Step 3, after 30 minutes post cleaning drying time, means जब dry हो जाए, dry होने के 30 minutes के बाद, जब आपने एक मतलब cleaning कर दी, cleaning के बाद आप surface के dry होने का इंतजार करें. जब dry हो जाए तो dry होने के 30 minutes के बाद spray diluted detergent, means 10 ppm अगर आप spray कर रहे हैं तो 10 ppm diluted disinfectant on all surfaces evenly. Step 4, let detergent sprayed surfaces be air dried. उनको आपने wipe नहीं करना, ना rinse करना है immediately. Let them air dry. उनको air dry होने दें. Step 5, enjoy auto disinfecting surface ready to fight bacteria, virus and fungus. Ideally, cleaning staff should perform this procedure early in the morning, right? ताकि आपको जो drying time है, dry time जो है वो आराम से मिल जाए. And once it is dried, like even up to 3 days, you can be fully satisfied that it will remain effective. अगर आपको है कि आपने 3 मरतबा रिंस करना है दिन में, तो अगले दिन आप पूरे दिन आप वाटर रिंसिंग करते रहें, फिर वाटर में कुछ मिक्स करने की जरूरत नहीं है. सिर्फ वाटर से फर्श धोते रहें, साफ करते रहें. पोछे वगैरह लगाने हैं, मोपिंग करनी है, तो वो सिंपल वाटर से फिर करते रहें. जो डाइल्यूशन आपने बनाना है वो डिस्टिल वाटर में बनाना है, टैप वाटर में नहीं बनाना, ना मिनरल वाटर में बनाना है. डिस्टिल वाटर में डाइल्यूशन इसके बनेंगे. Equipments and instruments. Perform cleaning as per existing practice. For example, vaginal probe है, so definitely उस पे gel है, तो gel को पहले rinse करेंगे, remove करेंगे. जो आपका standard protocol है for cleaning, वो वही रहेगा जो आप currently लेके चल रहे हैं. Once it's cleaned, let it be air dried, and then you simply spray. Like you can just simply spray using this sprayer on like the probe or any instrument, stethoscope, you can just simply spray, let it air dry, and then you can use. Ultrasound probe and instrument must follow standard cleaning and disinfection after each patient use. Fabrics, hospital textile uniform. Step 1, perform washing using standard laundry chemical already in use. Step 2, rinse with water. Step 3, prepare distilled water solution and mix 5 ml of 20 ppm detergent with 1 liter water. Accordingly, rinse 10 pieces of textiles in each run. Or, after rinsing with water and spinning, spray mist 10 ppm detergent disinfectant solution on all wet clothes evenly and let them air dry. कि आपने अगर मशीन में आपने नहीं इसको करना तो आप अगर धुल भी गए हैं तो जब आपने आपके जो लॉन्ड्री स्टाफ है जब उसने हैंग किया है तो हैंग करने के बाद उन्हें आप एक स्प्रेयर दे दें and they just evenly spray on all sides of clothes this detergent disinfectant. And once those cloths will be dry after misting, they will be having antiviral effects. So this is the take-home message. Follow social distancing, which is of course not possible in most of situations in gynecological settings, in healthcare facilities, where we need to do ultrasound, as we discussed, where we need to manage patients with the hypertension, preeclampsia, where we need to see emergency situations. Follow regular and cautious hygiene by hand cleaning and disinfection with long-acting, long-effect disinfectants, with persistent disinfectants, not short-acting disinfectants. Use mask whenever in public place, indoor or outdoor, or at office place. Always use ear loops and mask while removing. Don't touch outer surface. But on outer surfaces, you can simply, as ये मैंने जूम में भी ये कहा था कि आप simply outer surface पे रात को सोते हुए आप अच्छी तरह mist करके सो जाएं, and by morning it will be completely air dried, and then it is antiviral mask, it is antibacterial mask for another 24 hours. So every night while sleeping, you can just spray your mask which you are going to use in the morning, and that will be antiviral, antibacterial mask. SARS-CoV-2 can survive up to 3 hours indoor air and for several days on surfaces. Use disinfectant which can give longer protection to surfaces, fabrics, and PPE. In OT, labor, and OPD areas in particular, apply long-acting disinfecting on doors, handles, stair, railings, switch knobs, and glass. Use sprayers and atomizer for indoor environmental disinfection every 3 hours with detergent, colloidal, nanosilver particle disinfectant solution. Thanks for your valuable time and attending this webinar. May Allah bless you all for your courage and fight against this pandemic, and always stay safe. May Allah bless you. Thank you very much. Now, if you have any questions, we may proceed towards entertaining them. Thank you very much.
Thank you, sir, for your kind words and for the informative presentation. Now we would like to move towards the question and answer session. We have a lot of questions, so we will just go directly to the questions. The first question is that the silver nanoparticle that we have talked about, is it safe to be used in pregnancy?
Can you repeat? Is it safe for?
Is it safe to be used in pregnancy for pregnant females?
Like if it is exposed orally to pregnant women, you mean to say?
Yeah, the question is that if exposed in any matter via skin or maybe by the nasal route, or if by the through the eyes, is it safe?
Yeah, as I said, I got your question. As I said in presentation, that the concentrations are ultra low. The concentrations are ultra low for hand disinfection and for environmental disinfection. And at these ultra low concentration, there is no risk exposed to even pregnant women.
Right.
Or
thank you.
The offspring, the fetus and the pregnant woman. Like the concentrations are very low.
Perfect. Hopefully that would be the answer of that question. Moving on to the next question. we have, can we use silver nanoparticle spray for disinfection of ultrasound transducers?
Yes, as I said earlier, yes, it can be used. But before using it, as I mentioned in the protocol, कि आप जो क्लीनिंग प्रोटोकॉल है वो अपनी स्टैंडर्ड क्लीनिंग प्रोटोकॉल फॉलो करेंगे जो आपके ट्रांसड्यूसर्स और अल्ट्रासाउंड इंस्ट्रूमेंट्स की है because उस पे gel है because gel carries chemicals and it will interact with silver nanoparticles and it will nullify its effect. It may nullify its effect. So first you clean the probe, the transducer, and once it is clean and dried, then you can spray.
Okay, moving on to the third question. I think that this was answered, but if you can shed some light on it again. The question is, are silver containing textile detergents available in Pakistan? Or
just a minute, let me have just a moment.
Yeah.
Yeah, can you repeat your question?
Yeah, the question is, are silver-based textile detergents available in Pakistan? Or if we can rephrase the questions, if the detergent nano silver solution can be used on the textiles? If you can just repeat.
It can be used. It can be used in textiles at the concentration of like you will be using a 20 ppm disinfectant solution, and you will mix that 20 ppm with 5 ml. Each 1 liter will have 5 ml of 20 ppm concentration.
And a similar question. Yeah, please, sir.
Yeah, हर 1 लीटर के साथ 5 ml. मीन्स आप रेडी टू यूज जो है वो आप सिर्फ तब लेंगे जब आपने कपड़ों पे स्प्रे करना है, मिस्ट करना है. अगर आप कह रहे हैं कि मैंने वॉशिंग के बाद जो रिंजिंग के बाद जब सुखाने के लिए जो फेज आएगा उस पे मिस्ट करना है तो वो तो आप रेडी टू यूज 10 ppm यूज करें. बट अगर आपने वॉशिंग के बाद उसी वॉशिंग मशीन आपने डाइल्यूशन बनाना है तो फिर आप विद एवरी 1 लीटर you are going to use 5 ml of 20 ppm.
Okay, so 20 ppm of 5 ml, like 5 ml of 20 ppm should be used with 1 liter of water. And a similar question to this question, that does it have any effect on the colors of the textile, like on the colors of the cloth?
No, not at all. Not at all. Not at all. In washing,
Okay.
of course not. Even in misting, of course not. At least I am doing it. You are doing, Dr. Harris, since last 3 months.
Yeah. It has no effect on the clothes color.
Yeah.
The question, another question is, can the silver spray can be sprayed on the inner surface of the mask as well?
Yeah, you can, but that you need to do at night, not in the morning. Means you need to give longer period of time to dry out. And but inner पे आपको जरूरी है नहीं, आपको सिर्फ outer पे place करना है, आप अपने automatically भी protect करें.
Okay. So outer surface is more important than the inner surface, because obviously the outer surface is more exposed to the environment, and we have to make sure that when we use the mask, we are retouching the surfaces on the outer surface, so it should be clean and it should be virus and bacteria free. Moving on to, there have been a lot of questions regarding the pricing structure of the product, the availability of the product, and a lot of other questions, and that how we can use this. I'm just going to share my screen, or if you can allow me, sir, to share the screen. So I just am going to share the screen with the contact details of the people whom they can reach out to, and make sure that
like for hospitals, of course, Dr. Harris, I would like to say that the first thing which we are going to do is to immediately distribute the spray bottles, 100 ml spray bottles, immediately to all the participants who are into this session or who attended the first session in last week of June. So to both the participants, we'll be delivering 100 ml bottles immediately as a complimentary solution and support, so that immediately protection process start. And for later purchase for healthcare facility, if they will be purchasing directly, then definitely we will not hesitate giving very, very extraordinary package, very, very extraordinary price, ताकि जिस कॉस्ट में आप करंटली शॉर्ट एक्टिंग डिसइंफेक्टेंट यूज कर रहे हैं, हम कोशिश करेंगे उसके आसपास ही आपको ये कॉस्ट करें. बट ओवरऑल तो ये उससे बहुत ही सस्ता कॉस्ट करेगा, बिकॉज वो आपका 1 घंटे बाद प्रोटेक्शन खत्म कर रहे हैं, एंड देन इट विल बी गिविंग यू वेरी वेरी लॉन्ग टर्म इफेक्ट. बट डोंट वरी अबाउट द प्राइस.
I've just shared in the webinar chat. If you can go, you will be able to see the contact details of the people you can contact in cases of any queries you have or you had during the webinar and which were not answered, or after the webinar you have any question, you can contact on these numbers. And for further, as well as for the availability or the orders or any other such query, you can reach out to these numbers. There's one last question we are going to answer before closing the session, and I think this is an important question as well. And this is a question that a lot of gynecologists, a lot of people ask, and that is if the detergent nanosilver has any impact on, or does it leave any stains on the furniture surfaces?
No, not at all. Not at all.
Yeah, just to add on into the answer, we have been using this at a lot of facilities, and we have not have had any concerns or any queries regarding any such queries that if it is leaving any stain on the furniture or in that regard on any surface.
Yeah,
So
on furniture you are going to use, I'll just add on furniture and floor, in spraying and furniture, you are going to use 5 ppm dilution. आप जो dilution बनाएंगे distilled water के साथ, to be 5 ppm, and that's not going to, or even at 10 ppm, of course, there will be no stain on any furniture. 5 ppm, as I shared the report, PCR, it is equal, like effective 99.99% effective. So dilution अपना काम करेंगे, definitely dilution वो बढ़ेगा. यानी अगर 5 लीटर केन है, and it's making a 5 ppm dilution, so it will be around 20-25 with you. We can use in spraying furniture surfaces for a longer period of time.
Sir, can you repeat the lines, because there was some distortion. We were not able to hear you properly.
I was saying कि आप जब फर्नीचर को स्प्रे कर रहे होंगे या फर्नीचर को डिसइंफेक्ट करने, तो आप जो डिस्टिल वाटर के साथ डाइल्यूशन बनाएंगे वो 5 ppm का बनाएंगे, राइट? सो 5 लीटर का अगर केन है या 1 लीटर का ले, तो दैट मींस दैट 1 लीटर इज equivalent to 4 liters, and 5 liter is equivalent to 20 liters. तो 1 लीटर को आप 4 लीटर के साथ 4 लीटर डिस्टिल वाटर के साथ मिक्स करेंगे, automatically you will get 5 ppm. With 5 ppm and even at 10 ppm, we have not experienced any type of stain on furniture, neither on furniture nor on fabrics. So fabrics up 5 to 10 ppm, use on surface, on furniture surface 5 to 10 ppm, you will not experience any stain at all.
Just to clarify the because I think some of the participants were not able to hear. For furniture, you have to use 5 ppm. That is, you have to mix 1 liter of detergent solution with 4 liters of distilled water. That means if you are using a 5 liter can of detergent, you will get 20 liters of disinfectant solution, and that you can use on the furnitures. I think that's it from the questions side, and we'll be getting in touch with the participants of this webinar and following up, and we'll be making sure that if there are any further questions, they get answered very quickly. Thank you so much, Mr. Safar Rahman, for the lovely presentation. And I would like to thank every participant for taking out the time for this webinar, for this session. I hope this was really beneficial, and I hope that now utilizing what was discussed in this webinar, you'll be able to enhance the protection in your clinics and hospitals. May Allah bless us all. Have a good Sunday, and thank you so much once again for attending this session.
Thanks once again.